Hi guys, I'm a little sick, so bear with me. I can't really talk that loud. This is my concept map. I went ahead and did it on beta blockers. So that's going to be like hypertensive medication, so metoprolol, bisoprolol, and atenolol. So to start out, we're going to go right over here to drug class and action. Um, so it's a antihypertensive medication. That's its main purpose. It does block the beta adren adrenic receptors. So with that, it's going to lower the heart rate. It's going to lower the myocardial contractility, so how the heart's beating, and then it's also going to lower the conduction velocity as well as the workload of the heart, and it'll make the overall blood pressure drop. So from there, we're going to move on to indications. So why we're giving it hypertension. Hypertension is number one. Angina, so chest pain, any kind of heart blockages, heart failure, post MI, cardio protection. So dysarrhythmias, arterial fibrillation, and then as some off-label things that it can be used for are going to be migraine prevention as well as anxiety. So main indication is going to be hypertension, but there are also the off-label intervention or indications that we could use it for as well. So going from there, we're going to move over here. We're going to do side effects and adverse reactions. So bradycardia, hypotension. Hypotension is a big one that you need to look out for. Fatigue, dizziness are going to be common side effects. Bronchospasms, depression, sexual dysfunction, and then masked hypoglycemia in diabetics. Um, that is one thing about beta blockers with diabetics is you do need to keep a very close eye on it to make sure that everything is running smoothly when you are giving it. So moving on, let's come down here to contraindications. So asthma, COPD, non-selective beta blockers, you would not give them a beta blocker. Severe bradycardia, heart blocked second or third degree, hypotension. So remember, beta blockers are normally main function is going to be for hypotension. So if we're using it for hypotension, it's just not going to be good. You're just going to continuously have that BP drop, and that's not what we need at all. And then again, down here, caution in diabetes, masked hypoglycemia symptom. Sorry. From there, let's move on to the nursing implications. So what do we need to monitor? So we definitely need to make sure that we're monitoring the heart rate. We are not giving this medication if the heart rate is below 60, and we're definitely not giving this medication if the blood pressure is below 100. And then we're definitely going to monitor the blood glucose and diabetes because it is a big deal for them. And then size of worsening, so definitely like swelling, weight gain, stuff like that. Key patient teachings. Beta blockers need to be taken consistent, and then same time daily. Um, if you miss a dose, do not double dose. That is definitely not good. Just move on with the day and then start again. Change position slowly. So with this one, you just want to really make sure that, they're not getting up too fast and having the blood kind of rush from their head, getting dizzy, stuff like that. So just making sure that they're changing positions slowly and that that's something that they're able to do. And then they definitely need to avoid alcohol. Over-the-counter cold meds, definitely. They can increase the blood pressure and heart rate. And then definitely need to inform the provider if you're experiencing fatigue, dizziness, or any sexual dysfunctions. And yeah, that is my um, mm, mm, mm. that is my concept map. Thanks, guys.